This training, presentation, whatever you want to call it, is going to be short and sweet because it's very just information based, talking about our Caregiver Wellness Initiative. Some of you are probably familiar with it already because you've heard me talk about it, but this is an opportunity to get some of the background as to how or why we developed the program, and maybe just give you some information on how it's funded and how you can apply for the program, and also give time for questions at the end. And so our official start time is in like 30 seconds. I'll go ahead and say we're going to start, and anyone who's joining in later can just catch up. And again, if you weren't here like 3 minutes ago when I said it, I'll say it again. Please do remember to put your email in the chat, because this is how I will send you your post survey. And the post survey, once you complete it, if you complete it within 24 hours, you will get a $25 stipend from us. So they'll just give you a check in the mail to incentivize you to come to these education trainings, and also to help you pay for respite if you are utilizing respite services in order to take this training. It's just a way for us to let you know that you're appreciated. We're glad that you're here, and we know that your time can definitely cost you if you are having somebody else come in and help you. So we don't want anyone to miss out because of respite costs. So again, just make sure you put your email in the chat. If you do not do that, I cannot send you that survey and you cannot get your stipend, okay? So let's go ahead and get into it. The Caregiver Wellness Initiative is something that was already in place when I started working here, but it was, and it's evolved since I've been here, but the goal of it was to help people through the pandemic, right? So I'll go ahead and start with my first slide here. So caregivers, according to research by the Family Caregiver Alliance, y'all are showing a higher level of depression, stress, frustration, right? And you have lower levels of self-care, just statistically. And additionally, female caregivers are at a much higher risk of mental and physical consequences than their male counterparts. And this is important because approximately 90% of the caregivers currently enrolled on our respite program are female. So the majority of you are at a higher risk for depression, mental and physical strain, stress than your male counterparts. So not to say that the men aren't experiencing these things. It's just statistically, it's more often the females of the family who are the caregivers. And so they are the ones hit with this a little bit more. But this right here shows you that mental health is it's a component of overall wellness, right? So we can't just throw all of our eggs into the self-care basket and forget about the mental health portion of it. And so I hope that through this training, you'll realize that even if you don't take advantage of our Caregiver Wellness Initiative, that you could possibly incorporate some more mental health care into your own self-care routine, okay? Even if you're not at a point where you feel like you need mental health providers, like a professional, you can still find ways to strengthen your mental health, right? And hopefully this will give you that inspiration. So why did we do CWI? Why did we do the Caregiver Wellness Initiative? So we'll go ahead and start at the beginning, and I'll give you a little bit of background. So our organization, we take a lot of surveys. We like to get feedback from you all, find out what's working, what's not working. And so they're doing one-on-one caregiver supports and surveys of approximately 2,000 caregivers statewide. And Alabama Lifespan Respite identified lack of emotional and mental health supports for caregivers in underserved populations. That's like a growing problem prior to 2020. But of course, once the pandemic hit, it was amplified, right? Things that people were struggling with, they started struggling with even more. And so in response, Alabama Lifespan Respite quickly developed and implemented a variety of direct and indirect mental health supports for caregivers statewide, especially those who are in identified underserved populations, like veterans, minorities, the elderly, and a lot of residents who live in rural or medically underserved areas of Alabama. And so the intent of this support was to decrease caregiver stress, anxiety, fatigue, and burnout, and that hopefully would result in an increase in the overall wellness of our caregivers, and potentially help to avoid premature out-of-home placements for your loved ones, right? Because if you get to a point where you just can't do it anymore, you know, you need to call in some other help. And so by offering these services, we're attempting to give you that support so that it's not a premature placement, okay? So how did we identify the need for mental health supports in 2020? So the respite staff made welfare phone calls and check-ins on about 800 different caregivers on the program during the height of the pandemic. The staff quickly learned that stresses were running high, nerves were wearing thin, and some caregivers, especially those in rural areas, would maybe go for days or even weeks without talking to anyone other than their loved one. And so this slide here represents words and phrases that were heard repeatedly when we asked caregivers how they're doing. You all reported that you're tired, overwhelmed, stressed, unhappy, angry, felt alone. And some of you all felt judged by other family members for either doing too much or not doing enough for their loved one, right? So most caregivers said that they simply needed and wanted someone outside of their home to talk to. Many caregivers also expressed the need for professional mental health support. So simultaneously at this time, applications for emergency respite began to significantly increase. And the reason why is a lot of people were saying they're just overwhelmed, or they're stressed, they're burned out, and having mental health crises. That was the reason why they were applying for that respite, emergency respite. Caregivers were struggling because they'd lost the one thing that gave them a brief reprieve from the endless demands of caring for your loved ones all day, every day. Just that break, right? Everything shut down. There were no more programs. There were no more aides coming into the home, right? Because everyone had to quarantine and wear masks and stuff. And so it became the immediate goal of Alabama Respite to find new ways to support caregivers and their mental health while working through those COVID restraints. And one of the wonderful things about Alabama Lifespan Respite program is we have the ability to respond to caregiver needs in real time. And so the staff at the time began to brainstorm about different ways to offer indirect or soft supports until they could secure the grant funding necessary to offer the direct mental health supports from a professional. And so that's where you guys hear me talk about care chats. Care chats came out of this. It's like, well, what can we do now, right? Even if it's just talking to somebody outside of the home about your issues, that seemed to be very helpful for y'all during the pandemic. And so we continue to do that today because it was such a great, it was received so well. So indirect mental health supports helped, right? And underserved caregivers helped you to deal with the sudden loss of those respite breaks and the intense isolation that resulted from the pandemic. But many caregivers were still in need of direct mental health support. And that means like one-on-one or by a professional. So the first direct support effort was to drastically increase the amount of caregiver mental health education opportunities that we offer. And that's why I do one every week. So prior to the pandemic, it wasn't a weekly thing as far as I understand. But after the pandemic, it did become a weekly thing, and that we continue to this day because it's been such, we've gotten such great support from you all about the information that we offer. So some of the topics that were covered: caregiver depression, anxiety, emotional wellness, how stress affects your mental and physical health, anticipatory grief, and much more. A lot of things that I've talked about already. And so these topics were presented by the staff here and also by professional mental health educators. So through this partnership, Alabama Lifespan Respite, we began to build a statewide network of licensed mental health providers who are familiar with caregiving stress and disability-related mental health issues. And so that network was utilized in our most direct mental health support for underserved caregivers, the Caregiver Wellness Initiative. And so that's why if you've applied for the program, you get that database, you get those names sent to you. So what is the Caregiver Wellness Initiative? So to further support the total well-being of unpaid full-time family caregivers in the state of Alabama, we established the Caregiver Wellness Initiative, or CWI, and this provides funds specifically for free mental health counseling to caregivers who are currently enrolled in any lifespan respite reimbursement program. So that's DMH, Universal, CARES program, anything like that. So why is it needed? again, the intent of the CWI is to stabilize a mental health crisis for our caregivers, so that we can decrease stress for y'all. We can decrease the need for emergency respite, help you with your anxiety, fatigue, burnout, right? And just your overall caregiver wellness. So again, and we don't want to have any premature placements and out-of-home care. If you're still wanting to take care of your loved one at home, you just are having a mental health crisis, CWI is designed to kind of help you get over that hard spot so that you can continue to go and do what you do for your loved one. So how do caregivers learn about it? Well, we share information either through direct email or post mail. We'll send it straight out to you. It's on our website, it's on social media. We've even done print and television news. Anytime there's a respite education or awareness opportunity, we take advantage of that. So I'll often do tables at resource fairs and promote the Caregiver Wellness Initiative as well as our reimbursement program. And so we try to get the word out in as many avenues as we can. And that's exactly why I'm doing this today, because a lot of people still aren't sure what it is and if it's applicable to them. And so hopefully by the end of this, if you feel like you need the help, that you are clear on how to get that. A lot of times people ask, how do we pay for all this stuff, right? And that's a good question, but it's funded through grants from the administrations on community living, Administration on Aging, Federal Lifespan Respite, the Daniel Foundation of Alabama, and the Venturi Brighter Day Employee Fund. So I'm not sure if that's important to all of y'all, but some people do call and ask. They don't want to get into a program unless they know where the money's coming from, and I totally respect that. That's fine. So that's why I wanted to give that information to you today. So how does this program work? So now that you know why we established the CWI, I'm going to share how it works for programs or for caregivers enrolled in our reimbursement program. So upon receipt of the application, so you do have to apply, eligible caregivers will receive at least one CWI stipend, and that stipend is good for 3 counseling sessions per year to be used with a licensed mental health provider in Alabama. So again, we maintain a statewide list of available licensed mental health providers who are familiar with caregiving stress, disability-related mental health issues. And so, of course, you don't have to have somebody who specializes in it, but it is kind of nice to go into a space where you don't have to explain yourself and they already know what you're talking about. And so caregivers, you can choose any provider from that list, or you can choose someone else. It doesn't have to be off of that list. As long as that person or that provider offer or accepts direct payment. So basically, instead of them billing you or your insurance, they'll just send us the bill and we pay it, okay? So why did we decide to start with 3 counseling sessions? Well, the decision was made based off of the collective recommendations of mental health providers that we partner with. So it's the general consensus that 3 sessions can stabilize a mental health crisis in most situations. So caregivers will begin with 3 sessions, and if it's mutually agreed upon by you and your provider, that there's more sessions that could be beneficial to you to stabilize that mental health crisis, then we will award another stipend so that you can get up to 6 sessions from us, okay? And so how does the program work? I kind of touched on in the last slide, but I'll just go through it again just so that we have a really clear idea of how this works. So Alabama Lifespan Respite will pay the mental health provider directly up to the awarded stipend amount for services. So if they say they charge $150 per session, it'll be up to 3, that stipend will be worth 3. Okay, so like $450. We'll ask you to complete an anonymous pre and post counseling survey, which actually I think now they've switched it to just the post counseling survey. And really it's very simple. It just allows us to be able to assess how well it's working for you. And it also does help when we try to get our grants to continue the program. People want to see how effective is it? Is it working well for everybody? And so that's why we do the post survey. And anyone who's expressed a need may also be eligible to receive technology to access therapy via telehealth. So if you don't know what telehealth is, it's basically like seeing your counselor online, right? So just like we have these Zoom meetings, It's real time. That's what telehealth is. And sometimes if you are in a rural area, or you don't have transportation, or you don't have anyone to come in and provide respite services for you so that you can leave the house, telehealth can be very convenient for you to get that mental health care that you need. And if you do not have a device that allows you to get onto the internet, we can provide you with a tablet so that you can get online and have that telehealth services. And again, that's not at any cost to you. So if you go to our website, you'll see that our application is very short. It's just a very quick Google form, kind of very similar to what you use when you register for these trainings. And so it doesn't require any additional paperwork, and there are no income requirements for this program. So we want to make this process as easy as possible for you, especially if you're in need of mental health support. The last thing you need is another task handed to you to overwhelm you. So we try to make it as simple as possible for you to get access to these resources. So we do a lot of evaluation after we do these programs. Again, that's what the post surveys are all about. And so it is positively impacting caregivers based off of the feedback we get from them. So since September of 2021, requests for our emergency respite due to overwhelming stress, burnout, and mental health crisis have decreased by more than 90%. So it seems like it's working, right? And one caregiver was quoted as saying, "I felt immediate relief from day one of counseling." Okay. And I think that's important to know that maybe not so much for, anyone born after 2000, but for most of us, we were not born after 2000, and mental health support really does kind of have a stigma around it, right? You think about way back in the day, and it's like, oh, I'm going to go see a shrink, and have somebody psychoanalyze me and stuff. And that's not what counseling is. Counseling is widely spread, utilized throughout the United States. It is incredibly helpful, and it's really just about cultivating that human connection, right? Being in a space that's safe to be vulnerable, that's somebody can give you tools to help you cope, right? A lot of us were not raised to have those kinds of skills. And so it's helpful to have a professional to come in and show you ways that you can empower yourself, and that you can build that, increase that stress resilience. And of course, I might be biased because I am currently training to be a therapist. But even if that were not the case, I can see the statistics, I can read the literature and know that mental health support benefits all of us. You don't have to be on the edge to get a benefit from mental health providers, okay? So obviously, this is really good feedback that we've been receiving, because now we know that we're able to provide a much needed direct mental health support to caregivers statewide, especially those in underserved areas. So what's the takeaway? As I mentioned earlier, the lack of emotional and mental health supports for underserved family caregivers was a growing problem prior to 2020. And of course, it was amplified in the wake of the pandemic. So we already knew it was an issue, and then COVID hit and just wrecked us all, right? So it was just definitely an inundating of these mental health crises. So that resulted in Alabama Lifespan Respite to identify opportunities to respond to these emerging caregiver needs, to reimagine what does traditional respite look like, and to create new indirect and direct caregiver mental health supports that we hope are impactful even well beyond that pandemic. So like I promised, it was a very short and sweet presentation. Again, we try to simplify this program, so there really isn't a whole lot to go into as far as how it works. But I do want to continue the rest of this training and open it up for questions or comments. Anybody who maybe has participated in the Caregiver Wellness Initiative that has some insight or some feedback that they want to share, or some encouragement. Now's the time for us to just kind of build that community and have those conversations. So I'll go ahead and stop the share, and I can see all of your lovely faces again. So does anybody have any questions? I know I kind of went through that info fast, so I have no problem going back around if I need to. So if you did apply for the Caregiver Wellness Initiative, I think it was back before the beginning of the year, this year, you may have been placed on a waiting list.